Hey everyone, welcome back to the Reinhardt's Rundown. Today we're doing a super quick video with 2 things you need to know when you have a patient starting nicotine replacement therapies, specifically when they're starting nicotine patches. Here we go. Number 1 is the right dose. The number of cigarettes that your patient smokes each day is what we're going to use to determine the right patch dose. More than 10 cigarettes per day, you're going to start with 21 milligrams and then dose taper that down to 14 milligrams at week 7 and again to 7 milligrams at week 9. If your patient is at less than or equal to 10 cigarettes per day, start with the 14 milligram patch, notice the tapering down to 7, and then eventually we can discontinue after week 9 when the patient's ready. So once we have the right dose, we have to think about number 2, how to apply it. First, we're going to open the packaging and place the sticky side on a clean, dry, less hairy area of the upper body or outer part of the arm, for example. Once it's applied, you want to ensure a solid stick with the heel of your hand for about 10 seconds. Of course, we'll keep the patch on for a full 24 hours to cut down on that early morning craving when the patient first wakes up. A few more tips. We really want to avoid broken skin or any rashy areas. We want to rotate that site every single day. Most often, the patch is applied to the upper arm, the chest, the upper back, or the inner arm. And really, we should also avoid using the same location within 7 days. Lotions, oils, aloes on the skin, avoid anything moisturizing, which could interfere with the patch sticking. And lastly, remember that we start the nicotine patch on that quit date. That's the Reinhardt's Rundown. If those reminders were helpful, go ahead and hit subscribe and check out our next video about when to remove nicotine patches.